Hi, my name is Magenta Simmons and today I'm going to be presenting on peer work in youth mental health. I'd like to acknowledge Elise Parlow, who contributed to the slides that I'm going to be presenting today. And so today we're going to take you through an overview of what peer work is, talk about why you might do peer work, so talk about the evidence base for peer work, going to talk about how to become a peer worker, what workplaces need to do in order to support peer workers, and then talk a little bit about peer work in action, so give an example of a project that I was involved in myself. So looking at peer work, there are three, core principles involved in the work that a peer might do. So first of all, there's respect, there's shared responsibility, and there's also mutual agreement about what's helpful, so moving it away from a diagnostic-based medical model to a peer worker, somebody with lived experience, sitting down with another person who's experiencing their own mental ill health and really working on what matters to that person and how they want to make sense of what's going on for them together in that dual sort of equal relationship. So of course, the lived experience that the peer worker might bring to their role could involve, and usually does involve, the use of personal stories, so their own experiences of being unwell, of seeking help, of receiving help, and their recovery journey that they've experienced themselves. And peer workers often use those stories therapeutically to engage, the person that they're working with in an ongoing process to try and help that person towards their own goals for recovery. So very much in line with the recovery framework. If we think about all of the different types of peer work that are out there, Health Workforce Australia did a literature scan and demonstrated that there are a number of different roles and terms for different peer work roles, and Elise and I have added a couple in there in brackets contributing to this large list. But essentially, when you whittle it down to the key functions, they can be categorised in 7 different ways. So individual advocacy, peer support, which is the focus of what we'll talk about today, systemic advocacy and representation, health promotion, education and training, quality and research, and coordination and management. There are other ways in which to differentiate the different types of peer work that might be done, and so an organisation called Mind in the UK have described the different factors that might contribute to how you conceptualise peer work, as whether or not it's group-based work, so group versus one-on-one individual support, whether peer work's really at the heart of the organisation and the organisational ethos, or whether it's a specific project that the organisation is undertaking, whether it's led by the service itself, or led by the peer workers themselves, whether it's in different types of settings, so whether it's community-based or in an inpatient unit, for example, whether it's formal peer work or peer support or informal peer support, and whether the relationship between the peer worker and the consumer is conceptualised as that, or whether they come to the situation in mutual roles. And also the mode of delivery. So some peer work and peer support might be delivered in person, or it might be delivered online. So there's a Victorian Centre for Excellence in Peer Support for mental health, and they have developed up a charter of peer support, and this comes from that document there, showing that peer support provides each person with opportunities to benefit from collective wisdom. It provides people with opportunities to understand and destigmatise mental health issues, a renewed sense of self-respect, understanding and belonging through being part of a circle of a caring community, Opportunities for people to rediscover and activate their own personal hidden resources. So really focusing on the positive attributes of the person rather than deficits or things that they might want to be stopping doing. Opportunities to receive hope, inspiration and empowerment for recovery. Opportunities to give help to others as equal to equal, so really emphasising that equal relationship, and a unique pathway to help. So peer work contributes something above and beyond traditional models of service delivery. Elise and I spoke about the principles of peer work, and she really felt that for peer work we value lived experience or expertise by experience. We recognise the rights and the responsibilities of the peer worker, and that might be in regard to various different parts of their role. We respect clear boundaries regarding privacy and confidentiality of both the peer worker and the client, so including when confidentiality may need to be breached, and we'll discuss that a little bit later in the barriers. We honour a peer-to-peer relationship rather than a hierarchical relationship, so trying to minimise that power imbalance wherever possible. We recognise that each person is an individual, and their recovery journey will be their own. So whatever the person feels is important in terms of their path to recovery, and however far along they are on that path to recovery, that is determined by the individual with assistance from the peer worker. And we value hope, courage and perseverance, acknowledging that recovery is possible for every individual. If you look to what's being done in youth mental health, and you'll see that there's a number of organisations, whether you look to the US, to the UK, to New Zealand, to Canada, to Singapore, there are peer support initiatives across the world. There is a paucity, I suppose, of literature about evidence for peer support, specifically in youth mental health services or settings. That's really a growing body of work. But there are a number of people out there really doing it, and some of the examples up here are really, going from national initiatives in the US and in the Canada and in Singapore to going to more service-based examples like Headspace Fremantle has peer support, going to things that might be specific to, for example, suicide up the top left there, and looking at really different groups. So there's some university-based organisations doing peer-led initiatives as well, up to Talk Life, which is an app for young people to deliver peer-to-peer assistance online and through web-based technology. So there's a lot going on out there. In terms of what's happened at Origin Youth Health at the clinical program in Victoria, there's been an innovative program running in youth participation and peer support, and it's comprised largely of two sort of aspects, I suppose. The platform team, which is a group of young people, pardon me, of past and current service users and clients of Origin Youth Health, and they consult on a wide range of topics and products, including research. They promote change in the clinical service. They conduct an annual survey, for example, about clients' experiences of using Origin Youth Health. They undertake public speaking and advocacy work, and they contribute to things like training. So there's a number of sort of contributions that they make to the organisation. There's also a peer support component of the youth participation work at Origin Youth Health, and that includes at the inpatient unit, where there's a regular in-reach to clients who are staying at the inpatient unit, as well as a lot of sort of informal being around the clients and offering support in informal ways. And then moving towards more formal appointments, so their peer support workers also offer outpatient appointments, and that's more related to being on a specific topic, for example, and that can be one-off appointment or it can be ongoing work. Okay, so looking towards the literature and what the literature says, there have been a number of reviews that have been conducted looking at peer work, including a Cochrane review that was published in 2013. There have been a number of other reviews as well. Larry Davidson's review on the right-hand side there from 2006 was undertaken with 4 randomised controlled trials. And there's been a recent review, peer support services for individuals with serious mental illnesses, assessing the evidence, and that was in psychiatric services. And that was really taking a broader look at the literature. There was also quite an important review done by Repper and Carter, which again included broader parts of the literature, and that was undertaken as part of a larger project by the Together UK initiative. So as I said, the Larry Davidson review from Yale University, he included 4 randomised trials, and so that was really as the evidence for peer work was starting to emerge. And then the Cochrane review has then updated consideration of randomised trials, and that includes 11 randomised controlled trials with a total of almost 3,000 participants. They categorise the studies that have been done according to consumer provider versus traditional provider, and the other category was treatment as usual with or without the addition of a consumer provider. The Chinman review, the most sort of recent one, I suppose, that I spoke about before, that has the broader range of studies, categorised studies according to 3 different types of studies. So peer workers added to traditional services, peer workers in existing clinical roles, and then also peer workers delivering quite a structured curricula. There's also a number of reviews undertaken in the grey literature. These are just some of them, including an Australian one in the middle there that was quite recent. And taken from that review, which builds on the academic literature and the grey literature as well, we can see that there are a number of areas where the evidence for peer work is supported. So if we look at the consumers or the clients that might be on the receiving end of peer work, we can see that admission rates and community tenure are improved when peer work is provided. It increases empowerment for people, it increases social inclusion, it reduces stigma and increases hope as well. In terms of the benefits for the peer workers themselves, it actually contributes to their own mental health and well-being. It improves their sense of acceptance, and also, of course, increases their skills and employment, factors related to employment. There are benefits for carers as well, again in relation to feeling more empowered and knowing more, improved relationships and improved social support as well. So some really key factors there. The last category is the benefits for the mental health services and the service system. So peer work promotes the engagement of consumers. It improves the organisational culture. And of course, there's the outcomes related to cost effectiveness. So for young people who are interested in becoming a peer worker, there are a number of opportunities. And so talking with Elise about her experiences of becoming a peer worker, she felt that it was important to say that lived experience is first and foremost the qualification that you come to the table with. And part of that is really learning to share your own story when and how you want to. There is a growing field of a peer workforce within Australia, and there are increasingly a number of sort of more formal training opportunities and qualifications that you can obtain to undertake peer work. So there's specific training. For example, Mind Australia does a 5-day course and a 1-day workshop. There's a Certificate 4 in mental health peer work, and that includes separate streams for consumer peer work and carer peer work. But regardless of training, Elise really wanted to point out that lived experience is still of utmost importance. Elise also wanted me to talk about volunteer work. So, she felt that by doing a few hours a week, for example, in a volunteer role, that you can really get on the ground experience to develop basic skills in peer work, and also to get a taste of what peer work's like, to see if it's the type of role that would suit your skill set and your, desires for what you want to get out of work. And over the past 20 years, I suppose there are an increasing number of paid positions, part-time positions, full-time positions for peer workers in Australia. and that there are number of different types of environments that peer work can occur. And so I suppose if you're considering doing peer work, then you need to be flexible to these different types of environments, because each has their own unique challenges. So, for example, working on an acute ward, subacute ward in community settings, you might have different expectations and different components to the role. So, in terms of considering peer work as a career or as something that you might undertake, I suppose there are a few things to consider. So, and this also goes towards organisations who are considering setting up peer work positions within their organisation, and some issues that might be relevant for a peer worker include job security, so having sufficient hours if it's casual employment, or having ongoing positions, so knowing that your contract's going to be renewed and so forth. Being really able to develop the necessary skills in each position. So looking at career progression as part of that. So if I start doing this role as a peer worker, where is it going to lead to? What skills can I develop in this? What professional development can I undertake? What career pathways are there in terms of peer work? And that's starting to emerge as a larger issue for peer workers. As I said, these considerations are not just for peer workers to think about, but also for employers. And any role for a peer worker must be mutually beneficial. So it must be something that's benefiting the organisation, but also benefiting the person undertaking the peer work as well, in terms of their own skill set, development and career pathways. So how can workplaces support peer workers? So there is a charter of peer support, and it's by the Victorian Centre of Excellence in Peer Support, and it states that peer support should be accessible to all who need it. Every person living with or experiencing a mental health issue has the right to access avenues to share their lived experience in a confidential, safe environment where they are heard, respected, honoured and understood. So if that's to be the case, then workplaces need to think about how to incorporate peer work. There are a couple of resources available from Origin, the National Centre of Excellence in Youth Mental Health. So you can see on the left there's the youth participation in early psychosis, which gives an overview of how to partner with young people in a range of different ways. And then on the right-hand side, there's the Experience Matters, a youth peer support training guide in early psychosis. So really looking at peer support specifically. From other organisations, for example, the Centre of Excellence that I mentioned before, there are online resources available there too, such as the considerations when setting up a peer support group, considerations when setting up a peer support service, and also considerations for when operating a peer support service, which focuses more on governance, evaluation, personnel, those sorts of issues. So they're available online. Supervision is a key role in peer support. Again, this comes from Elise. She really wanted me to mention the importance of supervision, of getting adequate guidance, encouragement and support within peer support. Professional development, so to continue those skills going, is also really crucial in supporting peer workers, as just like in any other role in a mental health organisation, it's really important to keep those skills up. And it allows peer workers to gain new skills and to upskill for future roles as well. So thinking about some of the things that might be required to support peer worker within an organisation, there's of course the initial training on the left-hand side there to really ensure that the peer worker goes into the role with the required skills. And on the right-hand side, to support that, there's the ongoing professional development. So anything that they need to be aware of in terms of whether it's working with different types of clients, or what's going on in policy with mental health, or different sorts of specific skills that they might need. It's really important for peer workers to maintain that ongoing professional development as well. Having good supervision, as I mentioned before, is really key, but also having some social support and some support from other peers is equally as crucial. And mentorship is the last area that I would argue is important in terms of providing some career development, perhaps from somebody not related to the immediate team that the peer worker is based in. And so to give a real life example of what supports might need to be in place for peer workers, there's a project that was run at Headspace Gosford with Deb Howe and her team called the Choice Project, and I was involved in this. And This was really about employing peer workers to deliver a shared decision-making intervention, so to support young people to be involved in making decisions about their own care at a Headspace service. But this was delivered by peer workers, so it's a bit of a dual sort of level of involvement within the intervention that was part of this project. But to give you an example of what we did for these peer workers, or what Deb and her team did for these peer workers, was really around some initial training. So specific to the project in terms of learning about peer work, learning about how to share and tell your story, learning about interacting with clients, learning about the service that you're in, all of those sorts of things, but also the standard occupational health and safety training that you have to undertake as these peer workers are employed by the hospital. So there was that initial training. Then supporting that was some predetermined training, but also some self-directed choosing of topics. So peer workers, as they undertook their role as part of this project, felt like that they would like upskilling in certain areas, and so that was provided to peer workers depending on their needs and their desires. The peer workers had a fantastic project manager who provided supervision and direct line management for the peer workers, and that was really about the day-to-day operations, I suppose. The 8 peer workers had each other, so there was some peer support in terms of the team themselves, but also there was an external peer worker brought in to do group supervision, so group peer supervision with the peer workers. And then in addition to all of this sort of scaffolding around the peer workers was mentors from any department from within the organisation, but not from the specific project team. So it might have been somebody in admin, it might have been somebody in IT or design who was matched up with the peer worker to provide some mentoring about work life and their career and so forth. So there was a number of ways in which the peer workers were supported to deliver their work, and I'll talk a little bit more about that project later. There are some other considerations, I suppose, that a workplace might need to think about. There's Larry Davidson's Noah's Ark rule, so there should always be at least 2 peer workers. You don't want somebody working by themselves in this type of role. But as with the last example, so we had 8 peer workers enter a service, and there was this was perhaps a bit of a challenge. So when I suggest at least 2, you might want to think about what number might be a little bit too much. So having 8 new colleagues start at once was involved a lot of change management for that project that I was talking about before, and also that it limited, I suppose, the degree to which other staff could get to know peer workers, because with 8 peer workers they were doing shorter shifts. So you need to sort of think about how many peer workers you might be employing and at what stage, whether you stagger recruitment and so forth. How to get diversity and sort of representation, I suppose, in the peer workers, depending on the needs of the service in which they might be working at, it would be an important consideration. So how you can really capture the experiences and the voices of young people who might be more unwell or who might be less inclined to apply for a peer work position, how you reach out to different types of people and try and include them in the organisation. How you promote culture change. So if an organisation hasn't had peer work at their place before, how you try and promote that culture change, and also change management for any change that occurs with the addition of peer work. Providing support for peer workers themselves, but also for other staff members as well, and to try and have a well-planned program. As I said before, there are lots of resources that can guide and help with this, but also to remain flexible so that you can really partner with the peer workers that are going to be employed in order to make sure that the role and the implementation of that role really suits the need of the peer workers and the needs of the organisation as well. There are a number of barriers to peer work that are worth mentioning. So these are taken from a couple of reviews. I'm trying to map out in the literature what some of the key barriers and challenges are to undertaking peer work. So thinking about existing attitudes towards recovery, so whether or not an organisation and the staff members within that organisation really place a value on the experience, the lived experience of the peer workers that are coming to work there, or whether there's some elements of stigma. Even in mental health services, it is still well and truly possible for stigmatising attitudes to be around, and so whether that needs to be addressed before peer workers become part of the team. Another barrier is role conflict and confusion. So not having clearly defined roles can lead to problematic implementation. Lack of confidentiality is another barrier. So, and this is in regards to perhaps perceived concerns about lack of confidentiality, whether or not peer workers are able to maintain confidentiality, but also the confidentiality around the peer worker themselves. So these issues need to be addressed in terms of understanding that a well-defined role for a peer worker is that they maintain confidentiality just as any other employee does, but also that their confidentiality may need to be respected in a different way, particularly if they have been a client of the service at which they're then going to be working. And so, of course, there are recommendations that a client wouldn't be both a client and a peer worker at the same service at the same time, if that makes sense. So also looking at the structure of the job. So as I've mentioned before, it's really important to focus on job stability and career development and opportunities for the peer worker, that it shouldn't be a really time-limited sort of project-specific based opportunity, that there should be some consideration that if that's going to be the case, then how does the peer worker really work towards the next step in their career at the end of that role, or either within or outside that organisation. And also thinking about social support, as I said before, that's really important. So it's about fitting in at work. It's about coming to an organisation as a consumer and as using those experiences, and how you manage the sort of the social interactions, I suppose, at work, but also things like networking opportunities. So how does a peer worker network both with other peer workers, but also just generally as any other employee would? Some other challenges can be boundaries. So, some of the peer workers from the project that I mentioned felt like they were not necessarily a clinician, but not a friend of the person either, and how they kind of get that balance quite right in the role that they do. And also how to sort of maintain, I suppose, meaningful and, reciprocal relationships with the clients that they're working with. Power is a bit of an issue, a bit of a challenge. So the idea, I suppose, of peer work is that you bring two people together who have a shared experience of either being unwell or seeking help for mental health issues. But of course, in peer work, the case might be that one of those people is getting paid while the other one is not, and so that can create a bit of a power imbalance, and consideration really needs to be given to how to minimise that where possible, but also in relation to other staff. So you don't want peer workers to feel lesser than the colleagues that they work with because they come with different expertise. Their expertise is by experience rather than by qualifications, although of course they're not mutually exclusive sort of categories as well. There's also challenges around the stress. So of peer workers being able to take care of their own mental health, and it's very common to have care plans and to consider the impact of telling your story in order to undertake the role of a peer worker, but also understanding that you're going to be in quite potentially distressing situations, hearing distressing stories from other people, and that also might be triggers. Being around mental health service might be trigger in itself for some people, and how to really cope with that to undertake the role of peer work is important to think about. Thinking about accountability as well. So one of the concerns I suppose that might arise from other staff working alongside peer workers is really about managing the risk of clients and also the risk levels of the peer worker themselves. And so obviously really clear support structures need to be in place for both of those aspects of the role. And then the last would be sort of maintaining that distinct role. So how do peer workers retain their unique perspective? So not becoming too much part of the team that you lose what makes you unique as a peer worker, and that you don't want to really lose the ability to sit down with another person as an equal and share your experience without becoming too much, I suppose, like a clinician. Not that there's anything wrong with that. And so in addition to stress, there's also consideration about accountability. So how accountable peer workers can be in terms of managing risk of clients, but also risk levels of themselves. There might be a perception within the workplace that peer workers will have risk issues, but as with any other staff member, that can be supported by a workplace. And also there's quite common to use care plans, as I said, and that can be in relation to risk issues. And also that as with any other person working within a mental health service, that management of clients' risk levels is the same, and that there's procedures to support that, and there are protocols about what to do in that case. The last challenge that I'll speak about is really about maintaining a distinct role. So peer workers bring to the table a unique perspective, and there can be a challenge to maintain that unique perspective over time if, particularly for peer workers maybe working with only one or two other peer workers, and how to really retain that unique contribution that they can make, that peer-to-peer relationship that they will have with the client, and not becoming too institutionalised, I suppose. So thinking about peer work in action, the example that I'll talk to now is about the Choice Pilot project, which is something that I mentioned earlier in relation to how we supported peer workers. And as I said before, this was run at a service in New South Wales, and it was really looking at combining peer work and shared decision making. So trying to involve young people with lived experience to work at a youth mental health service, delivering a shared decision making intervention to try and involve each client that came through the door. And this was the Choice Pilot project. So in terms of trying to evaluate this intervention to see whether it worked or not, because we wanted peer workers to be in the waiting room of the service, delivering the service to each and every client, we had to do a historical control group. So we collected baseline data, of clients that were seen at the service for a 26-week period where there was no peer worker, there was no shared decision-making intervention, and we collected assessment measures before and after they had their first appointment with a youth access team clinician. So the YAT team clinician, as I'll refer to them from now on. So it's their initial appointment where they have an assessment with the clinician, and then they decide about what type of part of the service they will access. So what we wanted to do then with the intervention was to really have peer workers greet the young person before they're going to go into this sort of large appointment that decides, I suppose, what type of help they will be receiving. And we wanted to make sure that the decision was a shared decision with the client. So the peer workers so we employed the peer workers, they were appointed and trained, and then during the intervention period where we collected pre and post data again for another 26 weeks to compare with the baseline cohort. This is when the peer workers, who you can see 7 of them here, there were 8, but the photo includes 7 of them. So where they sat in the waiting room, there were 2 on at a time, and the peer workers would help the young person complete a report that was part of this shared decision-making online tool that you can see on the left there. So it's really about what mattered to the young person, and then they would fill in what mattered to them, and then that report would go into their assessment with the YAC clinician, so the Youth Access Team clinician, would see what matters to the young person at the start of the assessment. Then they would do the assessment and use another part of the tool that looked at the different parts of the service that the young person could access at that particular service. And then they would make a decision about what was going to happen for that individual client. And then the client would return to the waiting room and the peer worker would offer some follow-up support. So that's the gist of the intervention, I suppose. And just to let you know that we had, in that baseline sort of cohort when the intervention wasn't running, we had about 80 young people who contributed data, so clients, and then in the intervention we were able to get data on a larger number, so up to 149. And just to show you that the two groups were pretty similar in terms of mean age and gender as well. So in terms of the results, looking at the study, so we measured satisfaction in both the group that did and didn't get the peer worker and the shared decision making tool, and they were both, there was no difference, but they were both quite highly satisfied. So it was hard to show a difference, I suppose, with the two groups because they were both quite satisfied with their care. We measured something called decisional conflict, so how confused the young person felt about making a decision about their own care. And we measured that before and after seeing the YAC clinician, and people had significantly reduced decisional conflict, so they felt much less confused about what to do about treatment in both of the groups. So there was a significant reduction in both the groups, but no difference between the groups. But then in terms of whether or not they felt involved with the YAC clinician, so we measured perceived shared decision making, how involved the young person felt with the YAC clinician, and the group that got the intervention, that got the peer worker delivering the shared decision-making tool, they felt significantly more involved in making decisions about their own care. And then we did some analyses that looked at whether or not feeling involved and feeling less confused predicted satisfaction, and it did, and both of those factors contributed to high levels of satisfaction. So in terms of the results of that study, it was quite an innovative study in terms of using peer work, and the peer work model that we had was really about peer work in itself, but also then the shared decision making. But we showed that that it was really resulted in positive outcomes in terms of making or helping young people to feel more involved in making decisions about their own care. And certainly from the qualitative data that we collected from the peer workers themselves as well, there were some really positive outcomes for each and every one of those peer workers. And peer workers continue to be employed at the service, but also for those who have gone on to other things, they've all had some positive outcome in terms of future employment, whether that be doing peer work at another mental health service, which has been the case for some, doing a different job, which has been what has been the aim for some of the other peer workers, remaining in the service and doing peer work still at that particular service, and also going on to future study and training as well, which is really exciting. And one of the peer workers from that project is now on the Youth Advisory Council for Origin, the National Centre of Excellence in Youth Mental Health, which is just fantastic for us too. So piecing this all together, today I've really spoken about peer work in youth mental health and showing that there's good evidence for peer work in mental health, and it results in positive outcomes for the clients at the service, for the peer workers themselves, for the carers, and from the service as well. There's an emerging workforce in Australia that's really been building, growing from strength to strength over the past 20 years, and there are a number of national initiatives and supports that are now available to promote peer work in mental health services. But there are some careful considerations that need to be sort of thought through and in relation to the barriers and challenges in undertaking peer work. But overall, a very positive thing to be undertaking. I hope you've enjoyed today, and I've certainly enjoyed presenting it to you. Thanks very much.